All right, everyone, we're going to get started. Good afternoon to all of our guests joining from the East, and good morning to those of you joining from the West. I'm Pamela Macy from the Blueprint Client Services team, and on behalf of us at Blueprint, we welcome you to today's webinar, News from the Headlines, Phase 2 of the OCR HIPAA Audit Program. Our team had the opportunity to attend last week's Healthcare Compliance Association Compliance Institute, where we had the opportunity to learn firsthand from OCR's Linda Sanchez new information about the OCR HIPAA audit program. Our goal today is to share those learnings with you in the hopes that it empowers your organization to move forward with the readiness activities that best prepare you to be successful in the event that your organization is audited. I am pleased to introduce you to our faculty for today's webinar, Dr. Bryan Cline, Chief Security Advisor for Blueprint Healthcare IT, and Stephanie Crabb, VP of Client Development. In addition to his role at Blueprint, Dr. Cline is the Managing Partner for Cline and Shizuoka Professional Services, LLC, which provides virtual CISO assessment and other strategic and operational information protection consulting services, including education and training. Bryan has served as the CISO and VP CSF Security Development and Implementation for HITRUST, CISO and Director, Information Security for Catholic Health East, a multi-institutional healthcare system of 34 acute hospitals. I'm CISO and Director, Information Security Risk Management for the Children's Hospital of Philadelphia, the nation's premier pediatric hospital. More recently, Dr. Cline spearheaded development of the Texas Covered Entity Privacy and Security Certification Program with the Texas Health Services Authority and partnered with ISC Squared to create the Healthcare Information Security and Privacy Practitioner Credential. Stephanie has been immersed in security and privacy compliance arena for over 10 years, leading client services efforts in these areas for Blueprint, Synergistic, and CTG Health Solutions to bring practical, industry-aligned, and affordable solutions and services to provider organizations and business associates alike. Before we get started, I just wanted to go over a few housekeeping reminders. Please use the Q&A and chat features to submit your questions and comments to the panel. We hope to address as many of your questions and thoughts as possible. When submitting your questions, please direct them to the host and presenter so that Bryan and Stephanie can best prepare to address them during the Q&A. Likewise, if at any point you have issues with the audio or video functions, please send a chat to host, that's me, and we'll troubleshoot quickly. Please note that this session is being recorded, and we will send out the link to the recording and slides next week to the email address that you provided on your registration. Our session today is scheduled for 1 hour, and we have a lot to cover, so with further ado, I am pleased to pass the baton to Stephanie.
Thank you, Pam, and welcome, everyone. We really appreciate your attendance today, especially on such short notice. This information is really hot off the presses from the time that we got to spend last week at HCCA, as Pam mentioned, and we're delighted to bring this information to you in such a timely manner. Our agenda for the day is as follows. We're going to cover very briefly the review of the Phase 1 audit program. We're going to then really spend the majority of our time on the audit program Phase 2. And hopefully provide you all with some guidance and lessons learned from our experience in working not only with covered entities that were audited during Phase 1, but the lessons that we have learned since then and the information that we were able to sort of take and digest from listening to Linda Sanchez's presentation. I do want to let you all know that the slides that I am going to be presenting to you all today are verbatim the slides that Linda presented last week at HCCA. The only thing that we've done is spiff them up a little bit to make them look a little nicer, hopefully make them a little easier for you and enjoyable for you to appreciate the content of what she covered. But everything on these slides that I'm going to cover is word for word what is in her presentation. In fact, when we send out the link to the recording and to the slides, we are also going to include that original deck that Linda Sanchez presented last week as well. So this first run of slides is an overview and summary of phase one. This is probably content that you all have seen many times prior or that you're familiar with. So I'm going to cruise through these slides pretty quickly so that we can really get to the new information that I think you all are really excited to hear. So just to review and recap, the program mandate for the OCR audit program is derived from the HITECH Act, Section 13411. And the opportunity for this program and the way that the OCR went about implementing it was to establish a comprehensive and flexible process for analyzing covered entities and their efforts to provide regulatory protections and individual rights. The idea as well was to identify best practices. As you all may recall, this was really billed to the industry as an educational and learning process, not one that was by design punitive in nature. So again, to kind of recap who had been involved up to this phase one activity, as you all know, OCR contracted with Booz Allen Hamilton for a couple of very important initial steps toward the audit program in terms of their development of the study, IDing all of the covered entities and cataloging them in a database. They then engaged KPMG to develop the audit protocol and to conduct the audits. And then finally, they engaged PricewaterhouseCoopers to perform an independent evaluation of the audit program. The building blocks for phase one, as you all again may recall, was a development of the audit protocol and all of the corresponding working papers, establish and define the database of the covered entities, to establish the methodology, and to conduct the survey of the entities during the audit process. And then finally, to conduct that program evaluation and then make available other materials, templates, et cetera, to the industry so that we could then be empowered to go forward and apply those lessons learned and best practices into our operating environments today. So in looking at phase one, again, the audit protocol design was, again, to create a comprehensive and flexible process. And as you all know, 155 audits in total were completed through December 2012 in two phases. An initial pool of 20 organizations were audited, and then there was a bit of a grace period sort of after that as OCR sort of processed the lessons learned from those first 20 audits, and then 95 additional audits were conducted thereafter. The protocol covered 11 modules, which you see here. Breach notification was one, the 3 safeguards areas of the security rule, and this list of areas under the privacy rule. The overall findings and observations from phase one, just to kind of recap for everyone, and depending on the kind of organization you are, I think this really does help to put into perspective for yourselves and your leadership a little bit of a trending and benchmarking that you can offer. So, only 11% of the 115 organizations that were audited had no findings, and you can see that cohort there was 2 provider organizations, 9 health plans. So health plans really performed quite well, and 2 clearinghouses. Security and issues around the security rule accounted for 60% of the findings. Providers had a greater proportion of the findings as compared to the health plan and clearinghouse entities that were audited. And I think, not a surprise to any of us, the smaller organizations that were categorized as level 4 organizations really showed the greatest challenge, not only in performing to the audit protocol successfully, but across all of the areas. And again, we know smaller entities, the physician practices that were studied, and some of the other ambulatory environments are, as resource constrained as any of us in their pursuit of these efforts. So again, the audit findings by the level of entity, level 4 organizations had the greatest number of findings, those small organizations, 41%, and then it was pretty well distributed between the other entities that were studied, 20, 20, and 19. By the type of covered entity, again, echoing Linda's comments, More of the findings were uncovered in the provider segment, then health plan, and then clearinghouse. So clearinghouse really performed the best overall. The findings by the rule, 60% of the findings were derived from the security portion of the audit, 30% from privacy, and 10% from breach. In the privacy findings in particular, and definitely take note of this slide because you'll see that when we talk about the protocol for phase 2, there's a great correlation between these findings and what the OCR is going to focus on in phase 2. So uses and disclosures of PHI was the area that had the highest number of findings. Notice of privacy practices was next. Administrative requirements, access to PHI, and then the right to request privacy protection followed as the major findings on the privacy rule part of the audit. On the security side of the equation, most entities without a finding or observation met the standard by fully implementing the addressable specifications. There's always been a lot of chatter about those that were addressable and those that were required. So I think it's important to note that the addressable specifications and the organizations that performed most successfully under the audit were really able to articulate and demonstrate their compliance with the addressable implementation specifications and not just those that were required. No complete or accurate risk assessment in 2/3 of the entities that were studied. And there's been so much follow on and fallout, from this observation to include the publication of the risk assessment toolkit that we saw come out last week. Again, more to follow and more focus on that as we learn about phase 2. The areas in the security rule, unlike privacy where there was sort of a really big piece of the pie where 40% of the findings were in one area, in security they were a bit more distributed. So the pie chart or these percentages look a little bit different here. So again, as you think about your own programs and how you all have tried to apply some of the lessons learned from phase 1, let's just sort of recap here. Contingency planning and backups, access management, media movement, audit controls, risk analysis. These were really the trends in those findings through the organizations that were audited. And again, I don't think any of these things, for those of you who have been practicing in this space and you compliance officers who provide some of the oversight and guidance in this space, would be surprised by any of these things. These are tough issues, and there are many layers to them and how we tackle them in practice. Breach notification by entity type. So let's start to move a bit more into breach. As you look here, provider organizations, more than half of them audited really had trouble demonstrating compliance with OCR's expectations across all 4 of these areas: notification, the timeliness of the notification, the method of notification, and the burden of proof as to with respect to, was it, was it a breach, and was it a reportable breach? Some of the same trend in health plans, very, very tiny piece in clearinghouse, but we would expect that, I think, as well from clearinghouses. They don't have as much direct contact, of course, with individuals and patients. The cause analysis was a part of the protocol and a part of the report of findings that was delivered to every entity that was audited. So for every finding and observation, the audit did identify a cause. So in looking across the causality analysis, what was very interesting here is that entities communicated that they were unaware of the requirement in these percentages across these areas. So 39% in privacy, 27% in security, 12% in breach notification. Linda, I've seen her present several times now and report out on phase 1. And I think this was a real head scratcher for OCR originally and continues to be that the gap of awareness in terms of the rules and what's stated therein really had the industry in such a quandary. I think those of us who've been in the consulting space, as well as those of you out in practice, it's maybe not such a head scratcher for us because the way that the rules are written and the use of the word reasonable throughout the rules really presents to us a wide range of possibility in the way that we go about implementing or responding to the compliance requirement. It really demonstrated and indicated that there is a gap between that performance expectation from the OCR and the way that those of us in the industry and in practice have been responding to that or preparing our organizations and actualizing our plans. The other causes noted were lack of application of sufficient resources. Everyone struggles with that. Incomplete implementation, and this was a tricky one because the tracking of the remediation plans, the detail in the organization's remediation plans that were audited, demonstrated that organizations were maybe not only identifying or misidentifying the tasks that were associated with remediation, but the timelines associated with remediation left many of those initiatives incomplete or undone. And so that was something that they were very attentive to, and I believe it does create a call to action for us around remediation, as that ties to meaningful use. For those of you who are meaningful users and the requirements of mandatory 14 and 15, I think this is another takeaway from the cause analysis. And then finally, complete disregard. There were definitely a few in that initial cohort in phase one that chose for whatever reason to disregard the requirement and not provide supporting documentation to substantiate that position. So here's where the rubber really hits the road and is sort of the segue to phase two. The top elements where unawareness of the requirement were identified on the privacy side were the notice of privacy practices, the access of individuals, minimum necessary, and the authorization requirements. On the security side, risk analysis, media movement and disposal, audit controls, and monitoring. Again, keep these bullet points blazoned on your head because they will absolutely come up when we start to talk about phase two. So here starts the new content. Last week was the first time that those of us in the industry really got to see some of the results of the PwC program evaluation. And so again, take note as we go through here because I believe for most of you, and it certainly was new content for us, and we tracked the space very diligently, that we actually saw any of the PwC review material presented. So let's go to the objectives that OCR put forth to frame and scope the evaluation that they requested of PwC. The goals were to look at the effectiveness of the protocol that had been created by KPMG and the audit process generally as it related to uncovering the compliance challenges demonstrated by the organizations that were audited. It also was to review the methods applied to include the review of the audit data, surveys of the audited covered entities, and the interview processes that were conducted with covered entities during the site surveys that were performed by KPMG. And then finally, to focus on the activities and resources facilitated in the audit program to really understand what the barriers were and the problems that might have been encountered both by the auditors and the covered entities throughout the administration of the program. So that was PwC's charter. Let's see what some of the lessons learned and some of the response from OCR has been as a result of that evaluation. So communication and outreach was an area that they looked at intensely. And you'll see here that the covered entities that were audited really gave fairly high marks to KPMG and to the OCR generally, that the communications prior to the on-site visit were clearly explained. They agreed that the communications prior to the on-site and what would occur during the site survey process were communicated fairly successfully. And I think most telling, 56% of the audited entities became aware of additional HIPAA regulations that would apply to their organizations through the audit process. So an achievement of maybe a higher level of clarity was accomplished during the experience that those audited entities that ensued. And in talking with a lot of the covered entities and those that have come out since the audit experience, universally, most of them will tell you that the audit experience was a very positive one for their organization. There were clear takeaways for them. They felt like they've been able to move their programs forward as a result of being audited, although all of them will also tell you, it was a stressful process and a painful process to go through that. The key finding here, though, is that 59% of the responding entities were not aware of the audit program prior to receiving their notification of selection. So this really pointed to the OCR, despite a lot of public commentary, despite a lot of PR that they felt that they did, that nearly 60% of the covered entities that were audited didn't know that there was an audit program. So what are the recommendations from the PwC report to sort of close some of these gaps? One, that OCR should continue to widely publicize the audit program and the results promptly to covered entities so that organizations can take action. For smaller entities, to really understand where smaller entities, particularly physician practices and some of these ambulatory providers, live and do their work and get their information. And then finally, after each year of audits, that the OCR should evaluate the areas of high risk and pervasive noncompliance, and then continue to create and publish toolkits that the industry can then use, review, and adopt into their own practices to the extent that they see fit. The selection process was also one that they reviewed. And some of the surveyed and audited entities indicated that the selection methodology should be published, right? There was a lot of, ambivalence about how exactly did we get on this list, and that maybe there was something less than random selection that took place. The OCR contends that random selection was their primary driver in the selection process, but that they did set some targets in mind across covered entities and across the sizes of those covered entities, level 1 through 4, that they wanted to accomplish to achieve a distribution and a meaningful sample for phase 1. The recommendation from PwC was that the OCR should consider this request and try to be as transparent as possible in the selection process so that people can feel good that they were not the subject of some other sort of targeting that might create some consternation or angst around that. In the selection process results, some things of the recommendations here. To revise the protocol to include the Omnibus Rule and reassess priority areas based on the program audit results and industry feedback. I think you'll see that in phase 2. Add steps to guide auditors in tailoring the protocol to the specific covered entity type. We are not all created equal, and our business operations are not all created equal. So to be able to provide the most meaningful audit experience to organizations based on their business operation, their size, their scale, complexity was also considered. And then to update the protocol to include test procedures that specifically address the review of specific types of documentation or controls. As you all may recall, there was no technical testing in the phase 1 audit protocol. And so there was some ambiguity for those entities that were covered as to exactly how the protocol was applied, given the fact that some of the test plan maybe could have been a little bit more robust. But again, everybody was sort of managing resources to the end, and this was the first foray. The recommendations here further go on to state that OCR should implement a risk-based approach for applying the audit protocols that would allow the OCR to determine the areas of the rules that require implementation of particular controls, and the OCR should consider a multi-tiered audit approach that can be tailored to the entity type, the area, or a hybrid. And as we know, for those of you, and you all are from practically every state in the country today, that you all are also dealing with a fair number of state requirements in some of the states in which you operate as well. And so the sensitivity of the audit program and the audit protocol, and in the interaction of the delivery of the audit experience, for that to be considered as well. As it related to requested documentation, hopefully by now you all have seen the document request list, and it was no small feat for organizations to pull that documentation together. But here's what the organizations that were audited said, that 87% of them said that the document request list was clear. They knew what the expectation was of them in terms of what they needed to provide. It was outlined clearly in the original request, and they believed that based on the breadth and robustness of the list of documents that they were asked to provide, that they felt that it provided them the opportunity to give sufficient documentation to the OCR for assessing their compliance. In other words, they didn't feel as if the OCR limited them in any way from being able to demonstrate in their documentation what they were doing in terms of their privacy and security program management. The survey comments on follow-up interviews also indicated some inconsistency, however, in the document collection process. The OCR was not clear in the beginning, KPMG was not clear in the beginning if these documents were to be transmitted electronically or in hard copy. It ended up being a hard copy. So the volumes of what the audited entities had to produce was extensive. There were some issues with the document repository that was created, and so organizations did have to submit and resubmit in some cases, which was just very time-consuming and labor-intensive for the audited entities. And there was also misdirection of the original audit notification letters so that the letters were directed to individuals that either perhaps were not still at the organization. They went somewhere where maybe the individual, the recipient, was not a person who really understood what was coming and to take action on that. And because the time sensitivity of the provision of the documentation request was so tight, originally 10 business days and then moved to 15 business days, that created some consternation for the audited entities as well. Recommendations on the timing and the staffing levels for the audits was also provided by PwC, in that the OCR implement a centralized staffing tracker, the benefits of which we see here: to capture historical data, to identify the appropriate number of staff required to actually to conduct an audit, more even distribution of man hours, staff assigned based on the nature of the entity, assign people with proper backgrounds. There was some concern about the level of proficiency of some of the auditors on the teams that were deployed out to the audited entities, and to enhance program oversight. So again, I think you'll see in Phase 2, the OCR has taken some steps to address these and mitigate these in the way that the process will be implemented going forward. Another recommendation was the implementation of electronic work paper system. The idea that the OCR really needed to establish an electronic repository and a submission process so that every phase of the audit program, from planning to fieldwork to reporting and monitoring, could be created, and that people would have access to that. And there would be even more transparency because of an electronic work paper system being implemented. Recommendations on the work papers here and use of representative sampling methods. For those of you that may have endured an audit, or for those of you who may have had a colleague go through an audit, it was very invasive and it was very exhausting as it related to the site survey process, touching many, many individuals, many, many departments. One of the entities that we had the chance to work with, it was everyone, from the CEO to dietary, and every department and every level of staff person in between. So the recommendation was perhaps a representative sampling method would not only help the OCR and the auditor get to some of the same data collection, analysis, and conclusion, but again would also create a better audit experience for the covered entity. and they provided Yellow Book Section 6.64 as a point of reference for this recommendation. The final report, what did the audited organizations have to say about the report that they got back? 80% of them felt that the report was clear and easy to read, that the report provided an actionable basis for bringing their entity into compliance, and that it adequately identified gaps between the HIPAA requirements and their entity operations and business processes. So there's still some room for improvement here, but overall, the usefulness of the final report was something that most of the audited organizations felt that they could take action on comfortably and conveniently. So here we go, phase 2. Who will be audited? What's the nature of these audits going to be? And what can we expect going forward? So, who can be audited? Again, any covered entity. It doesn't change for those of us who are in the covered entity population. Health plans of any type, clearinghouses, individual and organizational covered entities. And as we were hoping to see, I know many of the provider organizations that we work with said, hey, when are the business associates going to be brought into the fold? Business associates are also in the fold in the phase 2 audit program. How is the covered entity pool being evaluated and selected? So the same methods and the same resources and database that was established by Booz Allen Hamilton is going to guide the selection of the phase 2 covered entities. Random selection within each of those cohorts and within each of those levels, 1 through 4, will also be employed. And the goal, again, is to be as representative in the types of provider organizations as well as business associates that phase 2 of the audit program touches. What's different about phase 2? There will be a pre-audit survey that will be sent to 550 to 800 entities on the front end of this audit process. Everyone that receives a pre-audit survey is expected to complete the survey and return it back to the OCR. Right now, the survey is drafted and completed, and Linda shared that it was going through the necessary reviews pursuant to the Paperwork Reduction Act that are required before they launch this out to the industry. The OCR, again, pursuant to PwC's recommendation, will conduct address verification with these 800 or so entities this spring. So, if you receive a little jingle from the OCR to confirm your address, you know that you're going to be getting one of these surveys. From this survey process, the OCR intends to audit 350 covered entities. So, roughly half of those that receive the pre-audit survey. If there's one thing that Linda said in her session, and she reiterated it 2 or 3 times, was do not ignore this survey. If you get it, return it promptly, and that really does provide to you a potential notice of your selection. What's different about the audits in phase 2? OCR's internal resources through their regional offices are going to serve as the primary staff for these audits. She did mention that as it relates to the security audit, that they will be using potentially some third parties to support the security portions of the audit, but principally these are going to be OCR field staff from regional offices who will be conducting these audits. Selected entities will receive notification and data requests in the fall. So the survey process is going to take place during the late spring and early summer. From there, they will cull the flock to the organizations that they intend to audit, and those requests will come in the fall. The good news is it's only April, so we've got time to prepare. Interestingly, how OCR is going to select the entities for the business associate audits in Phase 2 are going to be through the names of the business associates that those that receive the pre-audit survey and those that are audited provide to the OCR. So very important for you all to be have good documentation about your business associates, because what you provide to the OCR is going to be the pool of business associates that OCR is going to select from for the business associate portion. The business associate audit subjects will come in another wave in the second half of fiscal 14 in calendar year 2015. These are desk audits of selected provisions. So again, a big change from Phase 1. By design, there is not a site survey component to this audit experience. The audit experience and the desk audit process are going to be dependent and reflect the quality of the documentation that the selected entities provide. And you'll hear us really kind of hammer this home in the recommendation section. And if there are findings from the desk audits that are such they rise to a level of concern or consideration, comprehensive on-site audits, as OCR resources permit, can and will be conducted. So how are they targeting the recipients or the organizations that will be selected for the audits themselves? Their goal is to audit 100 covered entities on the privacy element, 100 on breach, and 150 on security. And you can, I'm not going to go through the whole chart here. Y'all can look at this in reference. So the idea here, you'll see the distribution between health plans, providers, and clearinghouses across each of these areas, and business associates. So you can see the BA reviews all on the security rule. The timing, again, I've kind of alluded to some of this, but we're looking at spring for some of this notification, fall for the notification to y'all. Period of response is going to be 2 weeks again, and then the audit reviews will be initiated in October through June for covered entities, and in 2015 for business associates. She went to painstaking detail in her presentation last week to clarify the expectations of a desk audit, and you'll hear in Bryan's recommendations that clarity around what is different in a desk audit than an on-site survey and things like that is important. I think what you'll see also reflected in this methodology is also what you see from CMS and the things that you see from desk audits on the finance side. So the data request will specify content and file organization. They will look at only requested data that's submitted on time. They expect that all documentation will be current. The auditors will not have the opportunity to contact the entity. No opportunity for chatter and clarification. The documentation will stand. And submitting extraneous information was highly inadvised. We all know the best rules of audit. Give them only what they ask for and no more. So she really, again, stressed that point as well. Failure to submit responses in a timely manner may lead almost directly to a regional compliance review. There will be an electronic management system, so everything that you are asked to submit will go through this electronic management system. So they did also heed that direction from PwC. The criteria, auditors will assess entities' efforts through an updated protocol that is reflective of Omnibus rule changes and more specific test procedures, again, queuing off of the PwC evaluation report findings. They will use a sampling methodology. The desk audits will target particular provisions that were the high areas of finding from Phase 1, And they will publish the updated protocol in each of the 3 areas that are the target areas for the Phase 2 audits on the OCR website so organizations can have a chance to use that protocol to prepare. Of course, many questions were asked about the timing of that availability of that protocol. Linda could give no guidance as to that timing. I think that we could probably safely assume that those protocols will come in, screaming hot, kind of at the tail end of our preparation period, and we'll have to mobilize quickly. So what are the focus areas of the Phase 2 audits? For covered entities, there are 3 and only 3. Risk analysis and your risk management program. In the area of breach, it's the content and timeliness of notifications. And in the privacy area, it's around notice and access. And then you can see sort of what happens and what's expected as we move through 2015 and 2016. So that is a recap of Linda's slides verbatim and some of the commentary that she made in her presentation last week. I'm going to turn the attention to Dr. Cline, and we've got some recommendations and ideas for you based on what we heard. So with that, I'll turn the floor to Bryan.
Thanks, Stephanie. I appreciate it. Hello, everybody. Yeah, we're pretty excited about what's going on. At least I am anyway. I don't know about the rest of y'all, but I think that what we have to keep in mind here is that a lot of times folks will say, okay, there are audits going on. We're looking at 350 entities in this case, and you look at all the number, all the different types of entities out there, number of entities out there, and you think, well, it won't happen to me, right? It's like when you get in your car and you go off to work, you don't think you're going to get into an accident until you get into an accident. And so the idea is you don't want to be left there explaining to the police why you don't have insurance, for example. So we would recommend that, since you have to do this anyway in order to be compliant with the HIPAA security rule, and if you're a meaningful user, to be compliant with your attestation, you need to do the work, right? You need to have it, squared away. So go ahead and prepare like you're going to get audited, and then hope that you don't. So anyway, one of the first things you need to do when you're doing this work, not especially if you're going to prepare for the audit, is you need to get the right stakeholders together from the start. I know that in my experience, I've worked on different initiatives. Got with some of the principal stakeholders, like maybe I was working with the privacy officer on some issues, maybe the privacy and data and security data breach response process. And then so we think we got a pretty good process set up, and then we start shipping it off to other stakeholders, and the compliance officer, for example, comes back and says, "You got to be kidding me," right? so the idea is you need to determine who your stakeholders are up front and get them involved. And that's not just your formal your stakeholders, the ones you normally think of, but there may be some key players in the organization that has an interest in what you're doing. Maybe that's the CMIO. Maybe it's the CMO himself or herself. So you have to understand your organization and understand who has a vested interest in what you're doing, and then make sure those people at least have the opportunity to sit at the table. And then in terms of what you do to prepare, some folks would say, well, we don't know what the protocol is, so we don't know how to prepare. That's not exactly true because in this case, we're talking about, say, for security, risk analysis and risk management. There's a lot of documentation, a lot of recommendations out there, including some recommendations from HHS itself on how to conduct a risk analysis. And, of course, you also have, say, a ton of NIST guidance if you wanted. So you can go out there and look at what's required for risk analysis and make sure that your risk analysis process incorporates those elements. And we're actually going to do a presentation on why your HIPAA risk analysis may not exactly be HIPAA compliant within the next 30 days or so. And I think you'll find it very interesting on what's required and the level of rigor that's actually required. So bottom line is, start preparing now. You want to focus on what's coming up in this round of audits, which in this case is risk analysis and risk management for security, for breaches, content and timeliness and notifications, and for privacy notice and access. But if you came in time to listen to Stephanie talk about documentation requirements, they expect documentation, for the desk audit. They expect documentation when they ask for it. And if you need time to prepare for that, you're not going to be able to give it to them. And if you don't give it to them, then it's not considered. And as far as they're concerned, you're deficient. And you don't want that to happen, right? So start preparing now. Make sure you have a good risk analysis, a risk management process in place. For example, a breach, investigation and response and notification process, that kind of thing. Make sure that you understand the inputs and outputs of those processes, and that and that the documentation that's required is actually produced, right? I know some of the first things that go when you're trying to keep the lights on as a CISO was basically documentation and training. You didn't have time for documentation, and you didn't have time or the budget for training, and those are very important, because you can't do what you need to do unless you have documented processes. People understand what they need to do, and they're trained on what they need to do. I would like to point out, though, just a second, if you go back to the last slide, sorry. I would like to point out that you can't forget about everything else you're supposed to be doing. Audit does not equal assessment. Okay, it doesn't equal analysis. And Linda, brought this home to us last week. I asked her, because in my travels, I'd seen folks that wanted to use the OCR audit protocol as the risk analysis, because it basically covered most, if not all, the security standards and implementation specifications in the rule. And so they thought that if they just assessed against that would be sufficient. And I was quite pleased by Linda's answer. I'm sure there are others in the audience that weren't, but the answer was no. An assessment based on the audit protocol, the last audit protocol, and definitely not this one, would not provide the level of detail and rigor required. So that's why I point you back towards the HHS guidance. Right, make sure that you do a comprehensive and accurate analysis, and that you've considered all reasonably anticipated threats, and that's the hard part. And we'll talk about that again, like I said, in another presentation. Next slide, please. Thank you, Stephanie. Appreciate it. Okay, risk analysis. Okay, you're going to see there's a common theme with all these slides. You have to build your methodology on something. And it's not always a great idea to build something from scratch, because in many cases, an organization, whether it be a provider, even a large provider, or even a large insurance company, may not have all the expertise they need in order to do a full-blown textbook risk analysis, or at least to develop one from scratch, the process and everything. So it's a good idea to look at what other people have done in that area and find something that you can tailor to your own needs. And you can look to the NIST framework for risk analysis and risk management, which is the next slide. Or you can say look at Octave, or whatever that you think you can tailor to suit your needs. But you need to do something, and you need to base it on something that say a reasonable person would consider would be appropriate for your organization, right? Again, we talked about stakeholders. You always have to identify the stakeholders that participate in the process, because the last thing you want to do is get everything prepared. You've got all your documentation on the process, everybody's buy-in, then you bring it to the board of directors for approval, or whatever level it is, and then somebody comes out of the woodworks and basically throws a monkey wrench in the process. So you want to try to avoid that as much as possible, especially if you're trying to get this stuff together before an audit. Right, and in other words, you don't quite have it done yet. Maybe your last risk analysis identified that areas of deficiency, and you're still working corrective action plans to get your risk analysis and your risk management processes up to snuff. So you want to make sure you do it right the first time. And it's so important that you define the process, because you need to know who's responsible for what. It's kind of like a RACI, right? You need to know who's responsible for what. If you're going to need external experts to help you develop the methodology, or if you're going to employ external experts, like say in your incident response process that's tied to your data breach, investigation and response process and notification process and all that. That say you have to employ external forensics firms like that. You got to make sure that all that is known up front, and you plan for it up front. Like maybe you put a forensics company on retainer or something like that. You have to understand the methodology. You have to document the methodology, and by that I mean you have to understand, in addition to the people who are doing, or working in the process, the methods that you're using and the tools that you're using to support the methodology. And those tools could be anything from just Word documents, spreadsheets, all the way up to something like a GRC platform or something like that. And then you also have to understand when your risk analysis process is applicable, when you have to do a risk analysis, because there are different points within the risk management process where risk analysis is appropriate. It can be when you determine what your initial controls are needed in order to address the threats that you've identified. The selection of a framework and the baseline set of controls from that framework. It could be the overlay that NIST talks about that basically tailors the controls to your specific needs, because even though the baseline is for kind of a generic organization, not everybody is created equal. So there's some unique threats that you may or may not face as an organization that you need to consider in your risk analysis and of course tailor your controls accordingly. Another one is when you have identified controls that you can't implement, and so you may want to do a risk analysis in order to determine whether a compensating control or an alternative control is appropriate for your environment. But there's all kinds of reasons why you do risk analysis, including the one for data breach, and so you need to know when that's applicable and what triggers that, and also how often you have to do it. For example, HIPAA requires a risk analysis periodically, but doesn't really specify when. So for some organizations it might be annually, and some other organizations maybe every 2 years, or even every 3 years might be appropriate, as long as you look at the environment, look at changes in the environment, and address those on a more frequent basis. And since risk analysis and risk management is hard, you need to train people not only in the basics about risk. They have to understand what constitutes a risk, likelihood, all that stuff, all the stuff that we love to talk about, security professionals. But they have to understand your specific methodologies, right? They have to understand your process. And that goes into training as well. It goes into exercising those processes as part of your training program. So anyway, I'd like to go on to the next slide. And this looks awful familiar, doesn't it? Because you still have to define and document your risk management program. Your charter, maybe your policy might specify some of the elements of your risk management program. You may have groups that you need a charter. Maybe there's an IT security committee or a risk management committee that you've designated to actually evaluate and accept risk on behalf of the organization. That all has to be clearly documented. Everyone has to understand the responsibilities, that kind of thing. And since risk management really encompasses many different areas of the organization, it's not just security risk. Your traditional slips and falls risk, your legal risks, stuff like that. There are many stakeholders in the risk management process, and so an integrated risk management process is the best. Basically, an enterprise risk management function, and supporting processes would best suit your needs. But even if you don't have something like that, there are going to be people that are interested in your risk management program and how you manage risk, and some of that might just be because they don't want you stepping on their toes. But you definitely need to make sure that they agree with what you're doing. They agree with the scope, they agree with the methods, and all that. And of course, all that has to be documented. So again, there's a process. If you're familiar with the term hamster wheel of pain, you'll know that refers to cyclical processes like risk management. HITRUST, for example, has a basic 4-step risk management process. NIST, I believe, has a 6-step one. These have a 9-step one, if I remember correctly, back in the day. But you need to adopt a life cycle for risk management that basically defines what your processes are, and then build those out accordingly. And of course, like we said, for risk analysis, you need to document all this stuff. There are specific inputs and outputs for the process that you would need to be able to provide to OCR should they ask. One of the things they may ask for, which a lot of organizations are having issues with, is the fact that you have to address all reasonably anticipated threats. Well, in order to demonstrate that you've done that, one of the things they may ask you for is a list of all the threats that you've considered as part of your risk analysis, which is obviously part of the risk management program. And as a matter of fact, risk analysis is step 1, just in case you're interested, of the 4-step HITRUST process. So you would need to be able to provide that list. If you don't have that list, then it'd be very difficult for you to be able to demonstrate to OCR that you have done a complete, an accurate risk analysis. So just keep that in mind. But there are other ways to do that. For example, adopting control frameworks that we'll talk about in that presentation I mentioned that we're going to do before I guess a month is out, 30 days are out. And then, of course, it's a cyclical process, right? So you need to remediate and refresh those elements, as required by your process, how you've laid out your risk management program. So if you require annual risk analyses as part of your risk management process, if you require for say all accepted risks, risk accepted by the organization to be reviewed annually and all that, you're going to make sure that you not only that you do it, but you have it documented, and you can provide that documentation in case it's asked. And then, of course, just like for risk analysis, this stuff isn't rocket science, but it's not easy. They need to understand the basics, and they need to understand the specifics about your risk management processes. Okay. So let's talk a little bit about breach. The breach risk assessment process is part of the overall incident response process. As CISO, I was primarily concerned with the security incident response process back in the day. But then, of course, when high-tech came out, we're starting to look at, privacy, incidents and how those are investigated. And then we have to do the evaluation necessary in order to determine whether or not a breach occurred and whether a reportable breach occurred. And then, of course, there's the whole notification process associated with that. But all that is tied together. So, one of the things we did in the past in terms of risk analysis, and what this bullet points out, is there was a kind of a high watermark. We had to show that there was a high probability of harm, significant probability of harm, in order for this for the breach to be reportable. Well, that was kind of a get out of jail free card for a lot of folks, and so a lot of times they didn't demonstrate, even though that maybe they should have, that there was a high risk of harm for this breach, and so it wasn't reportable. And of course, they were concerned about that, so they changed it. They flipped it on its head, and now it's something called low PROCO. It's a low probability compromise. So it's on us now to show via a risk analysis that there's a low probability compromise to this breach. And if we can't, then the assumption is that it's not a low PROCO and it's reportable. Okay, so I think you're going to see a lot more incidents being reported to HHS now. So anyways, I would say that's probably one of the most important things you do. If you send them your risk analysis methodology as part of your incident response process, and you're still doing that high or significant likelihood of harm, you're probably going to get a couple of eyebrows raised at OCR. Just saying. Okay. So anyway, again, identify the stakeholders that participate in your breach risk assessment process. And there's lots of folks that do that, and you have users involved too, right? But you think about who might be involved in this: legal, public affairs, the compliance officer, privacy, your CEO or COO may be involved. So just think about that. And of course, if you have a process, you have inputs and outputs of that process. There's documentation associated with each of those inputs and outputs, and you need to be able to provide that documentation should they ask for it. And again, we don't know exactly what they're going to ask for at this point, but if you've done it for all the different at all the different points within your process, then it doesn't really matter. All you have to do is rename it according to whatever format they want, and then you send it to them and you're done. Then of course you have to train, and this is really something that you really need to train on, because when a breach occurs or an incident occurs that may result in a breach, and you're going through all this process, things are happening pretty quickly, right? And this is where tabletop exercises, and other types of exercises are very important, because you don't want anybody having to refer to a manual, the procedure manual, in order to figure out what they need to do, right? It's just going to slow things down, and you're probably going to end up missing something. So this is something that you really need to train on, and I would certainly be able to demonstrate that I have trained my people on that, because that may be something they ask for.
Hey, I know we're at the top of the hour, everybody. We're going to try to, close this out in the next 5 minutes, but again,
okay.
Keep in mind we're going to be recording and sending that out to everyone. But for those of you who can hang on with us for another 5 or 10, we'll be delighted to have you hang on the line. Thanks, Bryan.
Okay, yes, ma'am. I'll try to speed it up. We talk about breach notification. There's some organizations that may have one template. Others may choose to have more than one. Sometimes organizations, for example, will issue a notice of a breach, even if there's a low probability of compromise. Not a lot of them do it, but some do. So there may be a template for that. Then, of course, there's two types of breaches that you're primarily interested in terms of something that is reportable. There's one where there is no evidence of compromise, right? So you can kind of reassure folks that so far, everything looks good, but, you can do this for them, whatever that may be. And then the other one is, well, okay, we know that we've been compromised. There are some issues, and then, you want to let people know what they need to do. And so that might be a little different. And then you would want to know for sure in terms of your procedures, what the triggers are for those, when you'd use one over the other and who makes that determination. And of course, you want to be able to train stakeholders as necessary because this is all part of your breach response process. Timeliness, absolutely important. You have to make sure that your incident and breach management processes are fully integrated. And I'm talking about the security side, the privacy side, the data breach, piece, all that. All that needs to be tied together, and all the triggers, and all the points where they interface need to be clearly documented and understood by everybody. This is a very complex environment. We have business associates out there. We have, other business partners we share data with. It's absolutely important that these triggers get put, into these agreements. So the business associate agreements, if you're a government agency, memoranda of agreement, your data use agreements if necessary, your SLAs, if you want to put it in there. But you got to make sure that everybody understands who's responsible for what and what the timelines are if you're going to make your own timelines for reporting a breach. And then, of course, train. So real quick on privacy, I don't know if Stephanie wants to talk about this. I can talk about a little bit. I'm not a privacy professional per se, but you need to understand who you are and what parts of the privacy rule apply to you. So if you are one of those folks that are in an organized healthcare arrangement, then you would have to make sure that you adhere to the joint notice requirements that are outlined in the privacy rule. You need to make sure your notice contains all the stuff that the HIPAA privacy rule says you have to have in there. And of course, make sure you go to the new version, because there have been some changes in the Omnibus rule in terms of the privacy language and the language in the privacy rule. And absolutely make sure that your notice contains language for any specific uses which may require inclusion, right? Whether it be for their consent or whatever. And then I think this is what they're really going to look at, because this is something that's fairly easy, is make sure that your notice of privacy practices is absolutely consistent with your policies. So I would expect that they would ask for your policies on notice. They would ask for the most current copies of your notice, and then they would do a comparison and say, okay, are you consistent? So don't get behind on that.
Yeah, one of the other things, just to add to Bryan's comment there, is the proliferation of the NPP across the organization. What they found in the audits in Phase 1 was that there were a number of orphan or artifact or outdated NPPs that were out there distributed throughout, the organization, so that they would find an instance of one that was from 2010, an instance of another one that was from 2008, another one that had been updated in 2012. So, it's really, really tough, all of the places that were required to make this notice of privacy practices available, and to make sure that your change management process, in the distribution of that and the availability of the NPP is in all of the nooks and crannies and all of the places in the organization where it needs to be available, both online and in print. And this is one where they just nailed people, because when they saw those incidents of those NPPs outdated, not appropriate, not tied to policy, it was an immediate, finding a deficiency. It's a challenge, but just keep that in mind. It's a great process to begin to look at, and how you're distributing that, how you're making that content available, because that's almost a no-brainer. All it takes is for them to find one, and they sort of assume that the organization is not as tight around this particular, around the notice as it should be.
Okay. in terms of access, there have been some changes in the privacy rule, regarding the right of access and the ability to opt in, opt out, and that kind of thing. So make sure you pay attention to who has access to a PHI, that you're adhering to the minimum necessary requirements and that kind of thing. Make sure that you can provide an accounting disclosures. This is something that a lot of folks are struggling with, because in the past, folks, and it was surprising that the compliance folks were actually happy at the time with their manual processes, right? But as more and more information got put into different types of information systems, EPHI in different places, it became much harder to determine who had access to that information and when. So, there are all kinds of things you can do out there. One of my favorites is a tool that allows you to actually import those logs and do all the correlation necessary, and then be able to provide reports on accounting disclosures. I won't mention the vendor, but they're pretty famous for this. And make sure you address all the elements in the privacy rule regarding the right to request restrictions on who gets your information or their information, especially that for if they pay for their own services and that kind of thing with respect to insurance companies. And of course, the right to ask for corrections to the information. If they notice that there's information that they believe is incorrect, and they have the right to request an amendment, and there are specific obligations in the privacy rule that you have to adhere to, and you would need to be able to demonstrate that you met those targets. So metrics, for example, on these requests and the timeliness of your replies and that kind of thing would be very important. I think, now that we're post-Omnibus, that it's very important that we understand our obligations to gain satisfactory assurances from our business associates that they're going to protect the security and privacy of the information we give them. It has to be consistent across the board. I think there's been a lot of problems with that in the past. But by consistent, I don't mean that you have to treat everybody equal, because not all BAs are created equal, right? But you should have a consistent methodology, how to basically rank the risks associated with these BAs. So they have some buckets like low risk, medium risk, high risk, because of maybe based on the type and or the amount of information you give them, and then once you put those BAs in those buckets, that you treat them all the same within that bucket. So if for the high risk, it requires, say, a third-party assessment of a certain type, whether it be an SSAE 16 SOC 2, or whether you're required to do your own assessments of these high-risk BAs, that you do them for all of them. Okay, you have to show consistency. Okay, and then, of course, you have to be able to demonstrate compliance with the policies they put in place around access. And so the best way to do that is based on your policies, based on your practices. You have specific metrics in place that tracks your compliance with that, and then you can provide that to OCR should they ask if they want you to be able to demonstrate compliance with your policies.
So, Bryan, hey, thank you so much. I want to thank so many of you for hanging on as we ran a little bit over. This next run of slides are all resources that Linda made available and pointed to in her presentation. So it's not necessarily new content, but I want to roll through just so you know the resources that OCR has made available throughout this process to bring the lessons learned and toolkits available to the industry. So as you know, they initiated some educational modules with Medscape, and so they just rolled out the 6th module in that program actually last week, and you'll see that destination page on this slide. The education tools here, again, this does translate into free CMEs, and so a great way, again, to involve your staff in the training process, especially as it relates to having some bang for the buck in terms of continuing medical education. Security rule compliance aids that have been published and the citations there, and then more information generally on the HIPAA audit webpage, as well as things on hhs.gov/OCR/privacy. I know we're over. We'll take a couple of, I'm going to field a couple of the questions, and then, what we will do between this week's presentation and we are repeating this same session next week. So if you have other colleagues, from your organizations who you think would benefit, that you want them to hear this too, we're repeating this program next Thursday, same bat time, same bat channel. The registration page is available on the Blueprint website. But I think one of the most urgent questions that was asked was with respect to who's going to get the notification. And again, Linda did not identify a particular functional individual, whether that's compliance, the CEO, general counsel, who would be the recipient of the pre-audit survey. But what she did emphasize was that, all of that information would be validated. So those of you sort of sitting in your chairs now, if we think about those who received the notifications in phase one, in many cases, it was to the CEO. So you want to sensitize your senior leadership to the fact that it might come to them. I think they realize that compliance is a very important channel. And we are doers by nature. This is our domain. So I know that part of what she said was that they were really going to also look to create that communication directly to corporate compliance or to the Office of the General Counsel. So that's still to be determined, but understand that there will be a validation call coming into your organization, and you definitely want to alert your risk management committee, who tends to be comprised of some of these senior leaders, to that fact. The other thing that was asked here was around the level of detail, to clarify some of the detail around the documentation. And, that is, the $64 million question. Again, going back to Linda's comments, these audits are focused in these three areas and these three areas only. The challenge and opportunity we have is to get very focused and very specific about our response in each of those areas. We've tried to sort of cull out in a very systematic and methodical way a process by which you all can take a look at what you have in place today, how to do your own sort of gap analysis, and then create your documentation. But certainly there's opportunity for collaboration internally, peer review internally on the documentation that you create, and then certainly the opportunity for you all to look at if third parties to support you in that process, or to come in and sort of do a readiness assessment on the documentation that you've created internally. But you start this process now, and everything is going to hinge, because these are desk audits, everything is going to hinge on that documentation. Many of you have audit colleagues in the organization who grew up in this philosophy, who grew up in these paradigms, and it's never too early to embrace and engage those individuals that have that expertise to help support you in that process of getting your documentation in order. So with that, we're going to save the rest of the FAQs. We'll bring them into a document for you all. We'll add those to the questions that we field next week. Appreciate so much, so many of you hanging on. I hope this was useful. We appreciate your comments back, so please provide us that feedback. And if you have any other questions, y'all let us know. Thanks so much. Have a terrific afternoon and a terrific spring holiday season. Thanks so much. And that does conclude our webinar. Have a great day.